On-the-scene video coverage of TCT 2012 is supported by Pradaxa.
Dr. Block, the master trial provides us a new approach to stenting. Is there good news?
Well, I think there's good news and good news, yeah. This is an interesting trial. It's an interesting stent. The stent is a Micronet covered stent. And the concept here is that if you have a micro mesh around a stent, that in acute myocardial infarction, where there's a lot of friable thrombus and debris inside of the infarct vessel, that the stent with this micro net mesh outside of it will entrap that and not allow it to go downstream, thereby increasing TIMI flow and decreasing infarct size, for example. That's the hope. And it's sort of an intriguing and interesting concept. So the trial tried to figure out whether or not this new stent with this covering was in fact effective. Turns out that the really good news is that TIMI flow seemed to be improved, and that ST segment resolution, that is the ST segment elevation resolution over time, was much quicker in patients that received this covered stent. And therefore, it seems as though this stent may have possibly significant impact in patients that are having acute myocardial infarction.
Any bad news?
Well, there isn't really bad news. I think the trial is underpowered, and when one looks at the clinical outcomes, death and infarct size, there isn't enough information to really tell you whether or not there is a difference between the patients that had stents and those that had regular stents. So this is really hypothesis generating in that respect in those areas. My guess is we will see larger clinical trials in the near future with this stent in acute myocardial infarction to give us the answer as to whether clinical outcomes are in fact impacted. We know frequently from other trials that although TIMI flow may be better and downstream flow may be better in acute myocardial infarction, it doesn't seem to have much effect on clinical outcome events. We'll see whether or not this new stent can in fact change that.